How Conventional Medical Germophobia Ruins Health by Joel Edwards, Organic Lifestyle magazine. For thousands of years, people thought disease was divine punishment for their sins. Eventually, the Egyptians and Hebrews noticed that contact with lepers could transmit leprosy, but even after this realization, knowledge of how people get sick progressed very slowly. Greeks and Indians learned to treat wounds with moldy bread, unwittingly using them as a natural antibiotic. The collective work and sacrifice of many scientists such as Dr. Ignaz Semmelweis, Louis Pasteur, Robert Koch, Emil Roux, and Sir Alexander Fleming changed our understanding of disease and how it is transmitted. But while germ theory tells us how people get sick, it does not tell us why some people become ill when others do not. While germ theory tells us how people get sick, it does not tell us why some people become ill when others do not. Tigitelu, Istock Cleanliness in 1847, Drive. Ignaz Semmelweis made the connection between childbed fever and doctors who worked with cadavers before delivering babies without washing their hands. Using simple logic and the process of elimination, he found lack of cleanliness to be the only difference between one clinic with a high death rate and another, run by midwives who did not work with cadavers with a low death rate. Semmelweis' revolutionary and controversial notion of hand-washing only gained acceptance years after his death, but once adopted, hand-washing reduced the childbirth mortality rate by 90%. Pasteurization. Louis Pasteur taught us that microorganisms do not develop without contamination. Before his experiments proved otherwise, general thought still supported the idea of spontaneous generation, that bacteria just grew from nowhere. Experiments with pasteurization and sterilized closed flasks proved otherwise. Pasteurization led to the prevention of food poisoning and the practice of proper canning techniques. Vaccines. Pasteur and Emil Roux invented the rabies vaccine, an incredible discovery that has saved countless lives. When human beings are infected with the virus, the disease is nearly always fatal if they did not receive a vaccination. There has only been one documented case of a rabies survivor who wasn't treated with a vaccine. Rabies kills more than 50,000 people a year. Louis Pasteur and Emil Roux's idea was genius. They treated the infected patient with the rabies vaccine, which contained a weakened virus. The rabies vaccine trained the immune system to fight off the virus before the wild rabies virus has a chance to multiply in large enough numbers to wreak havoc on the body by attacking the nervous system and the brain. Note: this was medicine used to treat a sick person, not medicine used to prevent disease in a healthy person. Antibiotics. Sir Alexander Fleming, a Scottish biologist, officially discovered penicillin in 1928, though molds and moldy bread had been used to heal wounds since ancient times. Penicillin was the first antibiotic, a classification of drugs that began with substances derived from molds and other microbes that either killed bacteria, bactericidal antibiotics, or halted the growth of other bacteria, bacteriostatic antibiotics. Later these natural occurring substances were replaced with chemical compounds or synthetic varieties. Related coverage. How to optimize your immune system naturally. We understand germs, so what are we doing wrong? If we focus too much on germs and how to defeat them, it's easy to miss the real goal, ensuring our health. Just because it is prudent to wash our hands before delivering a baby, before cooking, before eating, or after we go to the bathroom, doesn't mean we should wash our hands then constantly. Corey Thoman, I stopped cleanliness taken too far, learning that germs can be spread by the things or the people we touch doesn't mean we should wash our hands all the time, all day long. If wash your hands too often, you will dry them out. If you push it far enough, you can even make your hands so dry that the skin will crack and bleed, making you even more prone to infection. Just because it is prudent to wash our hands before delivering a baby, before cooking, before eating, or after we go to the bathroom, doesn't mean we should wash our hands then constantly. Constant hand washing isn't a problem for most of us, generally. It is reserved for those with obsessive-compulsive disorder. Instead, we made the mistake of thinking antibacterial soap was a good idea. Might as well kill the germs when we wash right. Wrong. Germicides such as triclosan and trichlocarbon are found in over half of all soaps sold in the U.S. There is no scientific evidence that justifies its widespread use, and there is a lot of evidence that suggests antimicrobials are actually quite harmful and make us more prone to getting sick. Even worse, if we do get sick, we are more likely to get sick with an antibiotic-resistant bacteria. Furthermore, triclosan acts as an endocrine disruptor in animal studies. It interferes with thyroid hormones. We have every reason to believe that it works the same way in humans. This could lead to serious health problems such as obesity, infertility, and even cancer. Unfortunately, these are not all of the problems associated with triclosan. Another study found triclosan interferes with muscle contractions in animal and in human muscle cells. This is of particular concern because the chemical penetrates the skin and enters the bloodstream more easily than what was originally thought. A 2008 study done by the CDC detected triclosan in the urine of 75% of the people they tested. Antibacterial soaps are the kinds of soaps most commonly found in public restrooms. But triclosan is also found in toothpaste, mouthwash, and even yoga mats. Antimicrobials are indiscriminate. They kill every kind of germ, including the beneficial bacteria found on our skin that are intended to outcompete harmful organisms. When we wash with regular soap, we do not kill all of the germs, but we significantly reduce their numbers, keeping your good microbes and limiting your exposure to toxins is better than trying to sterilize your hands. Besides, your hands will never be sterile. The best we can hope for is clean. Keeping your good microbes and limiting your exposure to toxins is better than trying to sterilize your hands. AP photo, Kiichiro Sato. Pasteurization taken too far. It turns out the majority of your food should be consumed fresh and raw, not pasteurized. Raw milk and raw juices are good for you. If we ate only pasteurized and thoroughly cooked foods, we would be depriving our bodies of vitamins, enzymes, and other nutrients. In our zeal to avoid harmful germs in our food, we could actually increase the likelihood that we will be unable to fend off an infection and become sick. Fresh, raw, organic produce provides our bodies with the nutrients it needs for a healthy immune system. Even the parts of produce that we can't digest, the fiber, encourage the growth and multiplication of beneficial bacteria in our gut, which in turn aids in meters and digestion, nutrient assimilation, vitamin production and more. Raw produce also provides us with enzymes to aid in digesting our food. We need the nutrients from food that pasteurization destroys. Of course, some food in a truly healthy diet can be pasteurized, but pasteurized foods should be eaten only in moderation. Related coverage: Chinese medicine, middle ground in the vaccine debate. Vaccines taken too far. It is just as naive to believe that we need a vaccine for every disease, as it is to think we need to wash our hands every 5 minutes. Unfortunately, the practice of vaccination has been taken so far that simply being alive and healthy means to many that we are in dire need of treatment, health and vitality.